So when we talk about bike fit progression, when we go through static evaluation and we go through changes on the bike, we progress. We start at the feet. We work to analyze their knee position as a function of saddle position, trunk and shoulders as a function of bar position, and then adjust the hand and wrist position through the bar and brake hood. After any change we make on the bike, we reassess measures and then document positions. In general, we position our foot forward such that our first metatarsal head is just forward of the pedal spindle, and we can assess this at what's called the 3 o'clock position, or where the crank is straight forward or horizontal. And when we're positioned, we also look at our cleats. If a person has a cleated shoe, we look at, are they worn out, are they asymmetrical? When we take a look at cleat positioning, we see here, this is an example of a cleat on the bottom of a road shoe. We see that this cleat can move forward and back, side to side, and can have some rotational bias. These cleats can also have some modifications. This yellow piece underneath here is a varus wedge. It can put you in it can bias forefoot positions by adding things in like that. You can also put footbeds or supports, but the order of which you should go through in establishing these cleat positions are establish your fore and aft position, your medial and lateral placement. These affect your basic width of stance, rotation bias of the cleat. We then accommodate the foot with the use of footbed or some sort of indwelling support within the shoe. And then if we need to, we can then potentially affect forefoot positions by having some sort of varus or valgus post, such as this yellow piece underneath. But this is the last thing we do as opposed to the first thing we do. The first four, these are the critical the first four, the critical pieces of cleat positioning on a shoe. Here's a demonstration of knee over pedal.